Assalamu alaikum. I am Dr. Noha Sharafuddin. I will talk a little about respiratory system examination, and you can see the accompanied video. Any system examination, as you know, composed of inspection, palpation, percussion, and auscultation. Respiratory system examination differ from a small infant or small child to an older child. In a small infant, the examination composed of just inspection and auscultation. In older child, more than 3 years or 5 years, you can do the whole 4 parts of the examination. Firstly, general examination, general look of the patient, and after that the general examination, then you go to chest examination. In general look examination, or in general look for the patient, you look if the patient ill or well, if the patient is dysmorphic, if the patient is in distress, if there is surroundings and accessories like oxygen cylinder, if there is any pot beside the patient for collection of the sputum, if there is cannula in the hand, and if the patient lying flat or not. This is the general look of the patient. After that, you go to general examination by examining the hand for clubbing, pallor, and different cyanosis. Clubbing, طبعا there is many obstructive lung diseases can lead to clubbing. Check the pulse and go to general examination for pallor, jaundice, and cyanosis, central cyanosis. Palpate the cervical lymph node and then go to the chest. Expose the chest, and by inspection you look for the chest contour, if there is any deformity, if there is bulging, if there is depression, if there is dilated vein, surgical scars, cautery marks, or hypo and hyperpigmentation. Any abnormality in the chest, you should comment about it. Then after the inspection, you go to and count, importantly count the respiratory rate and comment if the child in respiratory distress by showing the feature of respiratory distress اللي هي intercostal subcostal retraction, chest indrawing, nasal flaring, and so. That means the patient is using accessory muscle to breathe. After that, you go to palpation, as we say in older children, not in infants. You palpate for localization of the trachea. Normally it is central and slightly radiating to the right, locating the apex so as to rule out any mediastinal shift. So palpate trachea and locate the apex, and after that we can do a chest expansion starting from the upper zone, middle zone, and lower zone. Sometimes we can do the procedure of tactile vocal parameters by asking the patient to say 44 لكن commonly it is not used in pediatric, not important. After that you go to percuss or percussion, and along the anterior mid-clavicular line, the axillary line, starting percussion from the supraclavicular area on the clavicle itself and on the anterior chest wall. ودايما بيكون as comparison, يعني right left or left right on comparison manner. After that you go to auscultation. Auscultate also on comparison manner في mid-clavicular line and the axillary line and posteriorly. You comment finding بتاعتك في auscultation by comment about the air entry, type of breathing, the vesicular or bronchial. Mainly breathing in pediatric or in small children is bronchial, and added sound like crackles or wheezing and so. After that you go to the back examination by make the child sit up and flare his arms and to expose the scapulae and برضو بنعمل نفس الخطوات by inspection if there is any deformity, abnormality, anything, and percussion, palpation, percussion and auscultation. كده بتكون you complete the respiratory system examination. نرجع نقول إنه small infants no need, just inspection, count the respiratory rate, comment about respiratory distress and auscultate. And thank you very much and see the video above. Assalamu alaikum. Today we are going to do respiratory examination. First we start with greeting the patient, introduce yourself and explain what you are going to do. If the patient is old enough, you can take permission from him, or the patient is small infant or a small child, you have to take the permission from the parents. And now this child, we consider this as an old child. So we can take permission from him. Assalamu alaikum, ازيك يا احمد؟ كويس؟ انا داير اكتب عليك، ممكن؟ تمام. طيب first in examination as we said, you have to do general look. General look of the patient. Is the patient ill? Well, if the patient has evidence of feature, if the patient has symptom or sign of respiratory distress, and you look for the surroundings. If the patient is oxygen, patient life flight or not, if there is any accessories, cannula, if there is any pot for sputum collection. Like the general look of this patient is looking well, not dysmorphic, not respiratory distress, and there is no surroundings. Then we start with general examination after general look. Start with hand, look for if there is any clubbing, if there is any peripheral cyanosis, if there is pallor in the hand. Clubbing طبعا some chronic obstructive lung disease like cystic fibrosis can be present. The vital sign have to check for the pulse. After that go up in the patient tail. فوق يا أحمد. Long wrist. هنا يا أحمد. Cyanosis. افتح خصمك يا أحمد. Lymph nodes. Cervical lymph nodes. طيب. After that, we expose the chest. And inspect the chest. Firstly, you have to count the respiratory rate in whole minute. Okay. Then look if there is any sign of respiratory distress. Sign of respiratory distress is active LNSI, intercostal and subcostal retraction, and chest withdrawing. If the patient has fast breathing and intercostal subcostal retraction and chest withdrawing, and using accessory muscles, that means in this patient in respiratory distress. Now this patient not in respiratory distress. Okay. By inspection, we complete the inspection by looking for the chest wall. Look for deformity, any scars, surgical scars, any thoracotomy, any dilated vein, any deformities. If there is deformities, bulging or anything, you have to look for that. ممكن يكون في kyphoscoliosis or whatever. طيب. Look at diamond stand as the tip of the stand as the tip of the bed. Look for the chest movement. If the chest moves equally or not equally. Okay? احنا نشيل نفس كبير. Chest move equally. So this is the inspection. After completing inspection, we go to palpation. On palpation, we first localize the trachea side. Normally it is central and slightly weighted to the right. And localization of the apex. Yes, make sure in this place because of the if there is any mediastinal shift or anything. طيب. Palpation also we can do chest expansion. Start with upper bone. يلا شيل بس. to notice the movement between, or the distance between the two fingers should move equally. In the lower zone, his chest expansion is normal on both sides. Okay? طيب. After that, we can do what we call it. قول أحمد قول 44. ثاني
44
ثاني
44
ثاني
44
ثاني
44
ثاني.
44
We call it tactile movement frequency. يعني it is unnecessary, لكن we can do it in older children. طبعا not important in pediatric patient, commonly in adult, لكن we can do it if there is any suspicion of underlying pathology. Okay. After this palpation, we can do percussion. Percussion is start to percuss over the clavicle here for the apex orbital group and over the clavicle itself, and we start here. دايما بيكون comparison here and here, here and here, here. طبعا هي sometimes هنا في dullness بتاع الليفر, and here is the dullness of the heart. Okay. After percussion, we go to auscultation. طبعا البركشن والpalpation في small infant not necessary. The small infant just we do an inspection, comment on inspection and auscultation. Right. Because this child is old enough, we can do palpation and percussion. في البيك clavicular line في الأكسيلاري line. We comment about type of breathing, bronchial or physical breathing, and if there is any added sound. طيب بعد we examine the back. اللي احنا قلنا بعض. Examination of the back عشان to expose scapular you have to ask the patient to do like that كده يا أحمد كده. أيوه عشان نعمل expose شيء. Scapular and to examine the back easily. طيب برضه comment if there is any deformity, if there is dilated vein, surgical scar and whatever, and we can do palpation by doing 44 يا أحمد. طيب
44
ثاني
44
ثاني
44
ثاني
44
اوكي. يعني بتعملوا قدام تعملوا ورا. ثاني يس percussion and auscultation. اوكي خلاص نحضره ونشوف برضه اذا كان في any basic limitation or any and after that we cover the patient and say thank you. شكرا يا احمد to the patient.